Your Excellencies, ladies and gentlemen, welcome back to the World Bio Summit 2025. We will now begin session 1 entitled The Future of Health AI, Global Collaboration and a Sustainable Innovation. This session will examine international governance for the reliable deployment of health AI and the latest trends in health AI technology. It also discussed the role of the international community in fostering a sustainable health AI ecosystem. This session will provide meaningful opportunity to explore global collaboration models for the successful utilization of health AI. Ladies and gentlemen, please be with us until the very end. And with that, we will now begin this meaningful session with the opening remarks and words of congratulations. First and foremost, I'd like to invite Dr. Jung Yoon-sun, Deputy Minister of the Ministry of Health and Welfare of the Republic of Korea, to deliver his opening remarks. Let us welcome him to the stage with a big round of applause. Please welcome him.
네, 안녕하십니까. 대한민국 보건복지부 보건의료정책실장을 맡고 있는 정윤순이라고 합니다. 존경하는 각국의 기빈과 연사, 그리고 이 자리에 함께해 주신 모든 참석자 여러분, 웰컴 환영합니다. 오늘 세계 바이오 서밋 2025 제1세션의 개막을 선언합니다. 여러분께 인사드리게 된 것을 매우 기쁘게 생각합니다. 캐나다 보건부 사라 로리 차관보님, 대한민국 의학 한림원장 한상원 원장님, 김주환 서울대 연구부총장님, 세계보건기구 서태평양 지역 사무처 박기동 데이터 전략혁신 국장님, 일본 의학연구개발기구 유키히로 히시나가 국제전략국장님, 삼성서울병원 차원철 디지털혁신센터장님, 클라리트 란발리사 최고 정보 책임자님, 감염병 예방혁신연합 유턴와움의 AI 혁신 총괄 담당관님, 싱가포르 국립대학교 니안 키위안 인공지능 책임자님, 네이버 헬스케어 연구소 나구노 소장님, 한국과학기술원 예종철 교수님을 비롯하여 이 자리에 일일이 소개는 다 못하면 양해해 주시기 바라며, 이 자리에 참석해 주신 국내외 전문가, 각국 정부 대표, 국제기구 관계자, 그리고 산업계, 학계 모든 분께 깊은 감사의 말씀을 드립니다. 오늘 우리가 모인 제1세션은 보건의료 AI의 미래, 글로벌 협력과 지속가능한 혁신을 주제로 하고 있습니다. 인공지능은 이미 우리의 삶 전반에 영향을 미치고 있습니다. 특히 보건의료 분야에서 그 잠재력은 실로 막대합니다. 글로벌 인공지능 헬스케어 시장 규모가 연평균 42%의 속도로 성장할 것이라는 전망은 이를 뒷받침합니다. 인공지능은 진단과 치료의 정확성을 높이고 의료진의 임상 의사결정을 지원하며 환자 중심의 새로운 의료 패러다임을 열어가고 있습니다. 더 나아가 의료 접근성이 취약한 지역이나 필수 의료 인력이 부족한 상황에서도 효율적이고 지속 가능한 의료 서비스를 제공하고 공중보건 문제에 효과적으로 대응할 가능성을 제시하고 있습니다. 한편 바이오 서밋이 출범의 계기가 되었던 코로나19 팬데믹은 보건의료가 더 이상 한 국가의 문제에 국한되지 않으며 국제사회가 모두 함께 풀어나가야 할 과제임을 보여주었습니다. 인공지능 또한 장밋빛 전망과 동시에 개인정보 보호, 데이터 활용 간의 균형, 인공지능 활용 윤리, 기술 발전과 규제 속도의 불균형 문제, 국가 간 격차와 같은 여러 가지 중대한 도전에 맞이하고 있습니다. 인공지능 대전환 시대를 맞아 우리는 다시 글로벌 건강 수준을 향상시키기 위하여 인공지능을 어떤 방향과 전략으로 활용할지 지혜를 모을 시점입니다. 이러한 맥락에서 오늘의 세션은 매우 중요한 의미가 있습니다. 우리는 기술적 진보를 공유하고 이에 더하여 국제사회가 함께 마련해야 할 신뢰 가능한 거버넌스 체계와 공동의 규범에 대해 논의하게 될 것입니다. 대한민국은 축적된 IT 기술력, 우수한 의료진과 연구진의 역량을 토대로 영상 진단 분야에서 세계적 인공지능 기술력을 보유하고 있습니다. 또한 디지털 병리, 자동 의무 기록 생성, 응급실과 중환자실의 임상 의사 결정 시스템이 의료 현장에 보급되고 있습니다. 이러한 기술이 안전하게 활용되도록 제도를 정비하고 있으며 인공지능이 의료 접근성과 형평성을 높이는 방향으로 사용되도록 공공의료기관에서 의료 인공지능을 도입할 계획입니다. 대한민국은 이와 같은 경험을 각 국가와 나누고 경험을 토대로 세계보건기구를 비롯한 국제적 논의에 적극 참여하겠습니다. 존경하는 참석자 여러분, 오늘 이 자리에 모인 여러분 모두 각자의 위치에서 의료 인공지능의 미래를 이끌어가는 주역입니다. 여러분의 전문성과 경험 그리고 협력의 의지가 모일 때 우리는 인공지능이 제공하는 기회를 인류 공동의 이익으로 전환할 수 있습니다. 여러분께서 그동안 쌓은 경험, 노하우를 토대로 의료 인공지능의 활용 방향에 대한 국제적인 공감대를 형성하고 나아가 실질적인 협력 방안으로 이어질 수 있도록 많은 의견 개진과 토론을 부탁드립니다. 감사합니다. Thank you.
Thank you. Thank you very much, Dr. Chung, for your invaluable words setting the tone for session 1. Thank you very much. And ladies and gentlemen, now it is my great honor to welcome Ms. Sarah Lawley, Assistant Deputy Minister for Health of Canada, who will be sharing her words of congratulations. Let us welcome her to the stage. Please welcome her with a big round of applause.
Good morning. Thank you, Deputy Minister, for your opening remarks. Good morning, everyone. It is a real pleasure to be here with you today at the World Bio Summit. The shared commitment in this room to advancing public health, biotechnology, and inclusive innovation is not only impressive, it's mission critical. Looking around this room, I see leaders from government, academia, industry, civil society, each of you bringing unique perspectives and unique expertise. That is what makes the summit so valuable. The challenges we face, whether it's pandemic preparedness, vaccine equity, or the responsible use of new technologies, don't stop at borders. They demand collaboration, shared learning, and a commitment to collaborative action. And that is why I am so glad to be here with you this morning. I would like to take a few minutes to share some reflections on our main topic, health and AI, from Canada's perspective. We are already witnessing how AI is transforming healthcare, helping automate tasks, support clinical decisions, improve diagnostics, accelerate drug delivery, and enhance patient care. When used responsibly, AI has enormous potential to make care more efficient and accessible, to reduce the burden on our clinicians, to support our aging populations, and to drive innovation. And that's why governments and partners are working so hard to accelerate its responsible adoption. In Canada, this work is guided by our Pan-Canadian AI for Health principles, which all of our jurisdictions have agreed to and emphasize equity, privacy, transparency, and accountability. But AI is not magic. We heard this morning, junk in is junk out. It's only effective as the data that we feed it. The accuracy of outbreak predictions, the efficiency of resource allocation, and the effectiveness of our public health interventions all depend on the integrity and the lack of bias of the data behind the algorithms. To address this, Canada is working closely with our governments, our health organizations, our IT vendors, our providers, and patients to improve access to health data and to adopt AI responsibly. And remember, innovation isn't just about the technology, it's about the people. We need to build and maintain public trust so that their data is secure, used responsibly, and delivering on real benefits. We also need to promote digital health literacy so that patients, clinicians, and communities alike can actively shape the future of health data and AI. This is an exciting and fast-moving space. By working together and sharing best practices, we can make sure AI in healthcare is used responsibly, supports equity, is sustainable, and delivers real benefits, especially for the people here in the Asia-Pacific region. Many of us are here to listen today, to learn, to network, and to bring home new ideas. My hope is that this summit sparks more than just conversation, that it leads to action, new partnerships, and real progress. Let's leave here not just informed, but inspired and ready to make a difference. So thank you again to the organizers for making this event possible, and to all of you for your commitment, your participation, and your curiosity. I wish you all a very productive and inspiring summit. Thank you.
Thank you very much for that meaningful words. Thank you. So ladies and gentlemen, as Ms. Laurie just mentioned, let's learn, network, and bring home new ideas. Thank you very much for that one word. And last but not least, I'd like to invite Dr. Han Sang-won, President of National Academy of Medicine of Korea, to deliver his words of congratulations. Let's welcome him.
안녕하십니까. 의학칼림 원장 한상원입니다. 영어로 인사말을 준비를 했습니다. Good morning, ladies and gentlemen. I extend my warm welcome and gratitude to all scholars and experts attending this session. Perhaps, definitely, no one would dispute the healthcare is the most revolutionary field where AI is transforming the world. There is undoubtedly prevailing fear within medical community of being swept away and becoming victim of the high waves surging through the healthcare sector. However, if we surf that wave effectively, it will not only improve the health of people worldwide, including Korean, but also enable medical professionals to achieve more valuable and compassionate patient-centered care. Moreover, AI healthcare will accelerate new drug and vaccine development, improve unreasonable medical practice, and advance evidence-based medicine. Medical professionals will be able to work in an ideal healthcare system where humanity is the highest value, allowing them to connect more deeply with the patients. However, regulations protecting personal information and preserving national interests are also necessary, and these must be reviewed according to the dialectical theory of societal development. Domestically, support and regulation for AI healthcare must gain public consent while avoiding being either excessive or insufficient. Yet, standards differ between countries, making uniform application challenging. Furthermore, the entities driving AI healthcare development vary by nation. Some nations advance through the big tech company and numerous innovative firms leveraging capital strengths, while others pursue AI healthcare development based on government mid to long-term planning. Strategy inevitably differ due to varying national healthcare system. Data protection policy also differ by country. While this may be a drawback for the international advance of AI healthcare, it allows for indirect exposure of different institutional approach, potentially creating synergistic effect. I extend my deepest gratitude to organizer for arranging this event today, and I sincerely thank all the speakers and the panelists participating in the presentation and discussion. Thank you so much.
Thank you very much, President Han. Thank you. Thank you for celebrating the WBC 2025 with your thoughtful remarks. Thank you. And ladies and gentlemen, now we will welcome Professor Kim Joo-han, Executive Vice President for Research at Seoul National University, also the moderator for this session. And today he will introduce the session overview first. Let us welcome him with a big round of applause.
Good morning. Good morning, distinguished speakers and guests. I'm Joo-han Kim, Vice President for Research at SNU, Seoul National University. It is my great pleasure and honor to chair this session. The session title is The Future Health AI, Global Collaborations and Sustainable Innovations. In recent years, AI has shown remarkable capabilities in healthcare, and the new AI actually pushed away the old AI health-threatening avian influenza. We use that term, and this is actually the topic of the last presentation of this session. So we have now health-promoting AI, the artificial intelligence. From improving diagnostic accuracy and accelerating drug discoveries to optimizing hospital operations and supporting clinicians in complex decision-making processes, AI is emerging as a powerful problem-solving partner of us across the entire spectrum of health systems. The pace of development has been extraordinary, and we now see applications that are once unthinkable becoming part of everyday routine practice. Yet, with these opportunities, some important challenges come together. We have a concern that AI can amplify human biases, threatening privacy, and create opaque decision-making process if it is left unchecked. In health, well, decisions touch lives directly. These risks must be recognized and responsibly managed. Progress in AI must therefore go hand in hand with strong governance, ethical safeguards, and the trust of clinicians and patients alike. In today's session, we have 5 distinguished speakers with inspiring talks. We begin with the WHO's perspective on AI governance and policy, and then we'll explore the strategies for sustainable development of medical AI and consider how responsibility can be woven into clinical practice. Clinician perspectives on acceptance of AI will be highlighted, and we'll look beyond the digital transformation to envision intelligent health system. And finally, we close with an inspiring talk on an integrated AI machine learning platform for pandemic preparedness, the so-called DiseaseX engine. I hope this session will offer both insights and inspiration, showing us how we can harness our AI's power to solve our pressing healthcare problems while remaining vigilant about its risks and ensuring the innovations is always guided by responsibility and collaborations. Thank you, and let's start.
Thank you very much. Yes, please return to your seat, and we will be welcoming you back up on the stage for panel discussion after 5 meaningful presentations. With that, ladies and gentlemen, it's time to introduce our first presenter to the stage. The first presentation will be delivered by Mr. Park Ki-dong, Director of DSI, or Data Strategy and Innovation at World Bank Organization, Regional Office for the Western Pacific. And today he will share his insights under the topic of governance and regulation of AI in health. Let us welcome him with a big round of applause.
Yeah, 이건가요? Yeah. Good morning. My name is Ki-dong Park. I'm the Director of the Data Strategy and Innovation at the WHO, World Health Organization, Regional Office for the Western Pacific. I'm pleased to join you at Session 1 of the World Bio Summit 2025, co-hosted by the Ministry of Health and Welfare of the Republic of Korea and the World Health Organization. Next 10 minutes. Oh. Yeah, okay. Next 10 minutes, I'll tell you about the WHO's perspective on AI in health for future health equity. Oh. Before jumping into the main part of my talk, let me spend a few minutes to introduce WHO and then WHO Western Pacific region. WHO is the UN specialized agency in health established in 1948. WHO's mission is to promote health, keep the world safe, and then serve the vulnerables. WHO is a global intergovernmental organization with 194 member states and then 6 regional organizations. The WHO Western Pacific region is a home of the 2.2 billion people from 38 countries and then areas, including the Republic of Korea. The region is diverse in many aspects, from large populous countries to small island developing countries, from high-income countries to low and middle-income countries, from AI powerhouse to countries with limited R&D capacities. To serve this diverse region and move forward the common goal of the health for all, member states in the region have endorsed the new regional vision of the WHO work in the region, weaving health for families, communities, and then societies, which identified 5 priorities for collective actions of the WHO, member states, and partners, and 3 priorities for WHO Secretariat's work. The theme of this session, the future of the healthy AI, global collaboration, sustainable innovation, is well aligned with the priority 5 of the WHO's regional vision, technology and innovation for future health equity. Now, I'm back to my topic of today's talk. Let me share with a few key messages from the 2025 AI Index reports published by the Institute of the Human-Centered AI, Stanford University, early this year. The first message is AI is increasingly embedded in everyday life. This graph shows the number of AI-enabled medical products approved by US FDA. In 2023, US FDA approved 223 AI-enabled medical devices, up from just 6 in 2015. The second message is that global AI optimism is rising. According to the survey conducted by Ipsos, countries like China, Indonesia, Thailand see AI products and services are more beneficial than harmful. In contrast, optimism is still low in countries like Canada, United States, and Netherlands. There are still concerns on potential harm of the AI used in healthcare. Frequent topics of concerns, as mentioned by the Vice President Kim Joo-han, is bias, privacy, equity, and transparency, etc. Next, let me share with you a report from findings from the Government AI Readiness Index reports. It says that countries' AI readiness is uneven. While the index score of Singapore and the Republic of Korea is high, over 80s, but some countries in the Southeast Asia is below 50. With this context and then the story behind, WHO provide policy recommendation and technical support to countries on AI in health. Again, our emphasis is AI transformation should contribute to future health equity. WHO's engagements with AI began in 2018 when the AI for Health Focus Group was jointly established by WHO and then ITU. This brought the over 100 experts and the researchers to develop a benchmarking framework for international policies and attendance. It was migrated into a joint UN Global Initiative on AI for Health from July 2023. The global initiative on AI for Health aims to achieve three objectives: enable countries' AI transformation by developing standard, governance, policies, and guidance on evidence-based AI for health, facilitate AI transformation through pooled investment and the global community of experts, and implement AI in health through sustainable models of AI programs implementation at the country level. WHO produced a few normative guidance AI for health, such as ethics, governance, regulatory considerations. In July this year, WHO Western Pacific Region Office co-hosted a leadership forum in collaboration with Precision Public Health Association Asia, Monash University Malaysia, and the Ministry of Health Malaysia to discuss how to build synergy for public health technology and generative AI to realize precision public health in Asia. Key recommendation, key takeaway this forum was countries' trajectory of AI transformation should collectively shift from tech-centric perspective to problem, person, and population-centric trajectory. Countries should tailor their AI strategy based on their level of the AI readiness, and then greater investment is needed in public health and operational AI solutions. As of now, clinical AI solution to address clinical medicine is dominant. Public-private partnerships are critical for countries to subscribe to solutions rather than building the novel solutions by country by country. Multidisciplinary teams are needed for effective and sustainable implementation. Last week, WHO joined the Ministry of Food and Drug Safety to discuss how to harmonize regulation for AI for the future. And the next month, member states of the WHO Western Pacific regions will gather at the WHO Regional Committee for the Western Pacific. One of the agenda is AI in health. We expect delegation of the member states will share their views and then experience of the AI transformation in health. As a secretariat, we propose following 3 recommendations on the table for member states to consider. First, member states are encouraged to identify and priority high-impact use cases. We recommend priority should be given to a setting where AI can leapfrog infrastructure constraint or extend the reach of the overstretched health system. Second, we recommend member states to consider strengthening public sector capacity for responsible AI adoption by building institutional capacity within health ministry and public health agencies to engage meaningfully with AI technologies. 3, we recommend member states to consider overcome implementation and regulatory challenges. Items to consider is a fit-for-purpose governance mechanism, ethical oversight model, and the local capacity for health technology assessment. We believe by implementing these recommendations and then the discussions from the different fora, AI transformation in health will contribute to achieving future health equity. I'll stop here. Thank you.
Thank you very much for your invaluable presentation. Thank you to Director Park once again. Thank you. And ladies and gentlemen, we will now move on to our second presentation. And this time, we will welcome Mr. Yukihiro Hisanaga, Director of Japan Agency for Medical Research and Development. And today, he will be delivering his presentation on strategic support for medical AI development. Let us welcome him with a big round of applause.
Good morning. My name is Yukihiro Hisanaga from Department of International Strategy of Japan Agency for Medical Research and Development, AMED. I'm presenting today on behalf of our President, Dr. Hitoshi Nakagama, who is unfortunately unable to attend. In this presentation, I will introduce our initiative under the theme of strategic support for medical AI development. AMED is government funding agency for research and development in the medical field, established in 2015. Operating under jurisdiction of Ministry Education, Culture, Sports, Science, Technology, and the Ministry of Health, Labor, Welfare, and the Ministry of Economy, Trade, Industry. We provide support across the entire research spectrum, from basic research to clinical trials, aiming to facilitate the practical application of medical achievements. AMED launched a new strategic framework in April 2025. The central focus is accelerating translation of promising research seeds generated through basic science into societal benefits. To this end, we are enhancing collaboration between academia and industry from the early stages of development, promoting practical implementation through a robust industry-academia-government partnership. In the initiative, research and development of new pharmaceutical, we engage with international partners to advance research and foster talent. Recent technological advancement, particularly in AI, has brought transformative changes to the R&D of pharmaceutical and medical devices. Our goal is to maximize research outcome by leveraging these technologies. For example, in the efficient and effective identification of promising research seeds. Let me now outline our strategic approach to AI-driven research and development at AMED. Our efforts are broadly categorized into 4 key areas. Number 1, AI-driven drug discovery. AI technologies now enable advanced simulation, allowing for the identification of high-potential compounds at reduced cost and within shorter time frames. This is expected to significantly accelerate the drug development process. Number 2, health and medical data infrastructure. As a research funder, we are developing infrastructure for health and medical data. AI facilitates efficient data collection and utilization, and the quality and volume of training data are critical for AI development. We are actively working to establish this foundational infrastructure. Number 3, AI-based medical devices. The use of generative AI has enhanced technology for high-resolution medical imaging and lesion detection and analysis. Numerous AI-powered medical devices and software as medical device solutions has already received regulatory approval and are being implemented in clinical practice, contributing to early diagnosis and treatment. In the field of diagnostic imaging, AI adaptation is particularly advanced. Number 4, robotics for elderly care. In response to the challenges posed by Japan's super-aging society, including shortages of caregivers, we are committed to the development of assistive care robots. Let me share a specific example of AI-driven drug discovery. In this initiative, we are building a collaborative platform between academia and industry to facilitate more efficient pharmaceutical development. By aggregating diverse datasets, including interaction data between biomolecules and compounds, experiential knowledge from corporate chemists on structural optimization, and data on pharmacokinetics and toxicity, we are constructing a federal learning framework to engage 17 pharmaceutical companies in Japan. This enables the development of integrated AI drug discovery platform that support compound design, accessible to both academia and industrial researchers. By expanding data collection and utilization and beyond individual institutions, we aim to enhance Japan's overall drug discovery capabilities. This initiative also pertains to the development of foundational platform for drug discovery. We establish, maintain, and utilize advanced research infrastructures and facilities equipped with cutting-edge technologies such as cryo-electron microscopy. These resources are made available for shared use by external researchers along with the provision of high-quality technical support. In particular, structural analysis of protein using cryo-electron microscopy and in silicon analysis have greatly benefited from AI technologies, enabling faster processing, cost reduction, and analysis of complex protein structures. This platform also promotes industry-academia collaboration and supports human resource development and international partnership in advanced technological fields such as cryo-electron microscopy and bioinformatics. Finally, I would like to briefly introduce our efforts in developing data infrastructure. In Japan, legal framework, guideline, and system development are rapidly progressing to promote effective utilization of health and media medical data. At AMED, we are currently establishing mechanisms that allow the use of pseudonymized data while ensuring appropriate protection of patient rights, personal interest, and privacy. It is essential to ensure transparency in data governance, particularly in how data is collected, processed, and shared across research and clinical settings. Furthermore, as data and AI technologies increasingly cross national boundaries, we must also establish and adhere to internationally recognized ethical and legal frameworks. This includes harmonizing standards for data protection, consent, and accountability to foster global collaboration while safeguarding individual rights. By leveraging big data and AI responsibly, we aim to contribute to the advancement of drug discovery, precision medicine, and improved access to healthcare while maintaining public trust and ethical integrity. Finally, through collaboration with international partners, AMED aims to contribute not only to the health and longevity of people in Japan, but also to that of population around the world. Thank you very much for your attention.
Thank you very much for that valuable presentation. To Director Hisanaga, once again, please return to your seat, and we will be welcoming him. We will begin a panel discussion with our presenters later on. And ladies and gentlemen, now it's time to welcome our third presenter of session 1, Professor Cha Won-chul, Director of Samsung Medical Center, and he will share his insight on Beyond Digital, Building Intelligent Health Systems with AI. Let us welcome him with a big round of applause.
Good morning. Before starting, I want to express my gratitude for inviting me to this great session, and I'm truly honored to stand here to share my insights over AI in medicine. As introduced, I'm the Chief Information Officer of Samsung Medical Center, and I'm also emergency physician by training, and I'm also working as academia as a vice chair of Korean Society of Artificial Intelligence in Medicine. Before I go flying through my 20 slides afterward, I want you to take a moment and think about what is medicine. So in this ever-changing world, what is not changing is the medicine is think about the patient and the problem. You have to think that it's 1891, 150 years ago, the doctor had no choice, no tools to care for pneumonia, diphtheria, because antibiotics just came at 50 years after, but he thought about the problems. And he was finding the problem and also defining the problem. And that's what he do as a medicine still in these days. And we do not alone, we do it together to care for the patients as a team or as an institution and or as an organization. Not just for care, we share our intelligence, we transcend and we evolve through sharing and also through teaching. It didn't just happen inside one institution or one country, it also happens throughout other countries. And these days, hospital marked as a cornerstone of medicine in modern society. In Samsung Medical Center, we treat about 10,000 outpatient, 2,000 inpatient daily with 8,000 workers together. And we try to reach out their everyday lives because we know the lives of patients do not stay in the hospital. Their lives belongs to outside on their home. And you want to use our intelligence, use our knowledge to reduce the cost of care. Sorry, this is kind of running automatically. And we want to reduce the cost and increase access and quality together. And I want you to see that in the center, we want to use our topmost cutting-edge intelligence to care for our patients. In order to do that, we have to also think about the problems, the systems we are using to care for patients in modern hospitals. That start with network and hardware, EMR, data, algorithm, application provided a patient's family. Just like systems, like circulatory system, nervous system of human body, we have to dissect, we have to understand what we are doing with our patients. And there are many tools. The EMR stands for the essential basic platform because I told you 8,000 workers taking care of more than 10,000 patients per day. We need a robust and some basic platform to care for our patients. And also we need to tool. Sorry that it's not playing. Okay, so we need a tool because we have problems not just using human eyes, human hands. We need devices. We need the digital technology that can enhance our work because we solve problems that should be solved with the digital tools in a field of patient's care. And in those days, we call this a digital transformation. Sorry. Surely digital tools are working properly now. And we also see the problems. You want to hear from the patients more systemically and more robust way. And by hearing them on the patient's encounters are not enough. So we are sending them the tools so patients can enter their symptoms, their thoughts into our EMR directly. These days in SMC, we are sending out the PROs from 150 formats from 30 different departments, 10,000 cases per week, and the compliance rate is over 85%. And by doing that, we can overcome the problems that we might have and we will have. CDS is to solve out the problems that human brains, human minds are not good for repetitive and accurate assessment using the multiple data. Yes. So we have integrated several AIs in our EMR to help our providers, to help our doctors and nurses to assess patients and repeatedly in a more accurate way. Not throwing them the tools to burden them over, but to help them to reduce their burden of assessing information repeatedly. Also, robots, currently we are calling them physical AIs. Robots are great tools. They can reduce the burden of care providers, removing the supplies and sticking them for patients' care, and freeing their hands to take more time to take care of the patients. And while you are seeing lots of shining technologies, and see like interfaces and robots, and those cards are actually the computers, I want you to focus on the problems we wanted to solve, that we wanted to focus on patients' care, the direct patient's care. These days, in Samsung Medical Center, we have replaced all the logistics by 75% by robots, that freeing hands of our precious nurses, that they can focus more on patients' care than tedious works. Using AI is on top of these digital technologies. And the generative AI could be implemented throughout patient's journey and also provider's journey. And we have to be very careful not to increase the burden by putting more technology. We want to have a seamless and robust approach using the AI in clinical field. And it's not just one implementation. You want to have the technology inside, and you want to evolve. The AI should evolve, and also the human and the provider should evolve at the same time. We see the AI transformation as a part of digital transformation. The AI is not something new. we want to solve our problems for our patients and our care by adding digital technology and also AI technology. And I showed you 8 layers of technology we use in Samsung Medical Center. I believe there are 3 additional layers we want to add on to that. First, we want to implement a layer for multimodal prompt management system that is to manage the intelligence, the AIs, and to train them and to validate them in a platform that we can validate it and use it safely. Second is to high fidelity data system. It's a curated, highly modified data that not just data that we use every day, but the data we want to have as a golden standard of data. And by doing that, we can have this chain of works that start with curated data generation, multimodal orchestration, and also AI value creation. I want you to remember that is the cost, access, and quality we want to focus. How do we do that? We have friends here, and we want to have the great minds of people working together to solve the problems the medicine has had. Last time didn't work well. So if you are one wise and you want to stand against God, the God punished human to separate their languages, and the Babel Tower didn't finish. But if we be wise, if we set the destination in the right destination and work together, we'll be able to use the language model as the greatest tool we have to fulfill our task. That is to have sanctuary, that have the system that can be the place that we can take care of our patients. Thank you.
Thank you. We'd like to extend our sincere gratitude to Professor Cha for that presentation. Thank you. Next, we'd like to introduce our 4th presenter to the stage, Professor Ran Ballister, Chief Innovation Officer of Clalit Health Services. Well, he's here on the stage, and today he will be delivering his presentation on the topic, Weaving AI Responsibility into Clinical Practice. With that, we'd like to welcome him with a warm round of applause. Please welcome him.
Good morning, ladies and gentlemen, esteemed colleagues. This is truly my privilege and pleasure to be speaking to you today. I was asked to discuss the very complex topic of how do we make clinicians actually agree to use those wonderful tools Professor Cha was just presenting with us. And it is a challenge, I have to say. We all know healthcare needs fix. For those of you who are within the healthcare system, you know that even in the best places, there are serious problems. 1 in every 4 people walking into a hospital in the best healthcare countries gets out of there with damages caused by human error. This is not because of negligence. These are excellent professionals doing their best, but they're human, and humans make mistakes. Pilots also make mistakes, but they have systems preventing their errors from becoming tragedy. Doctors and nurses do not have that privilege. We need to help them. I'll give you one example to explain how AI can transform care for the better. In our system, we are trying to find hepatitis C cases. Hepatitis C is a blood-borne virus that is silent and causes liver cancer and liver cirrhosis. We now have a drug that cures hepatitis C if we provide it in time. But over half of the sick people do not get it on time because we don't know they have hepatitis C. So every year, we screen 50,000 people, over 5 million members at Clalit, trying to find those silent cases. And we find 38 cases, which is great. 38 people that will not have cirrhosis, will not have cancer. Can we do better? So we have been using AI ferociously trying to change that. And then we went over and went for 500 people with good scores on their AI. And how many positives did we find? 38 out of 500. That means that we've been able to improve our care of these patients 100-fold. How many advances in medicine have you seen in the last 100 years that improved your care 100-fold? And this is just one example. Just one. If you want the details, there's a paper about this that we wrote to the New England Journal of Medicine AI, and all the methodology is available to read. So what we tell our physicians is that AI gives you superpowers. In this case, the superpower to be able to recognize a silent illness that is not available to the naked eye. And Khalid can do this because it's the largest healthcare provider of our country, with over 5 million members that we care for, and we have had electronic health records for over 30 years. So all the data is available there, inpatient and outpatient, and all of the relevant data is available. We've been able to do AI in practice now for over a decade and a half. So in 2010, we introduced our first predictive model to identify patients that will have end-stage renal disease 5 years later, and come to them early when you can easily care for them and prevent their deterioration. And we reduced the rates of end-stage renal disease with this proactive approach. For over 10 years, we have been calling our flu to vaccinate with influenza every winter. We've called our patients ranked according to the likelihood that they will have pneumonia this winter, not according to their age. So this is so much better. We've been able to identify which patients will break their bones due to osteoporosis based on predictive models that put CT deep learning algorithms into practice. And we've been doing it for a while. So it sounds really appropriate and really great, but the actual reality is it is very, very difficult. Making AI-driven transformation in a hospital is everything but easy, and there's full resistance from everything, from the IT, from the privacy officer, from the cybersecurity, from the physicians, from the union, from the professionals. Everybody will make your life very miserable in this process, just so you know that. And the evidence from the world suggests that actually we would think that the best way is for the human in the loop. Physician and AI together would be best. But the data suggests this is not the case. AI alone is better than AI plus physician. I repeat, more and more data. AI alone better than AI plus physician. How can that be? How? What is the explanation to this? The explanation is very simple. Physicians don't trust the system. They don't trust the output of the models. They say, well done, computer. I am the physician. It's my final word. I'll decide. So if you want to have acceptable AI, I will give you a very simple formula to make physicians accept your innovation. It needs to be useful, and it needs to be frictionless, and it needs to be trustworthy. If you don't achieve all of these three, your AI will stay on the shelf. So we talked about useful. I've shown you some useful examples we've been doing for 15 years. Let's talk about frictionless. So I come, in this country, I just learned that you have, as a physician, 3 minutes with your patients. 3 minutes. In my country, it's 8 minutes. That's still not a lot of time. And then you tell the physician, look, I'm going to add to you all of these risk factors and indicators, and there's an indicator of this, an indicator of that, and polygenic risk scores coming in. And do you think they're happy to get all of those scores on their screens, the alerts? They're not happy about this. What you need, and what we've done in the last 5 years, is to coalesce all of this information into a single one-screen summary view of the clinical bottom line to allow physicians to be able to have proper care based on this. And our system, called CPI, or Clarit's Proactive Preventive Interventions, is a system that identifies the patients with future deterioration, but also suggests what to do with them. So if the patient yesterday had blood tests that suggest his renal function has changed, then today, even before the physician saw that, he will be able to see what drugs for the diabetes needs to be changed because now the patient has renal insufficiency. And not only that, for them to trust the system, it has to be explainable. So every suggestion needs to have the clinical reasoning put in front of the patient. It doesn't have to be completely explainable AI, but it has to be interpretable AI. It has to be something that the patient can have the clinical reasoning to explain the patient and himself why he accepts this recommendation or not. If you do not do that, they will reject. And now they actually accept it and they're happy with it. Because they feel, because the physician is very lonely in the room with the patient, and suddenly the primary care physician, he has with him a cardiologist and an endocrinologist and a nephrologist and a clinical pharmacist in the room virtually with him, providing him with the type of specialist advice and the safety net he needs to provide better care. So, if we want to be able to provide physician and nurses acceptable AI, it has to be useful, it has to be frictionless, and it has to be trustworthy. Now, the problem with a lot of the new models, you've seen all the concepts of transformer-based models, LLM, foundation models, they have some advantages, but they have some problems. They lie and deceive and hallucinate too often for us to be using in many times of clinical practice. They take the biases in the real world and statistical additional biases and make them pervasive to increase the problem of bias. And it is a problem to say, how do we regulate this? Because regulators cannot move quickly enough in the face of such emerging technology. In the high-level advisory group to the United Nations Secretary General, we have had the privilege to address some of these questions, and I urge you to read the report that has just been also, big recommendations from this has been enacted by the recent UN Assembly in order to do better governance. But if you want really trustworthy AI and you come to the single hospital, you don't know what to do with all of those high-level recommendations. Be safe, be effective, be responsible AI. What does that mean when you have a deluge of suggested vendor-driven AI solutions for you? To help hospitals and health systems deal with that, we have created the Optica framework, which takes you by the hand, and the checklist approach allows you to be able to suggest exactly what should you do and who in your hospital should be doing it. What is the role of the clinical lead? What is the role of the data specialist? What is the role of the MLOps and of the organizational AI lead? And if you follow this checklist, you will be able to provide responsible AI on the edge. So, we've seen the formula. And if we will do this, we will have proper AI-augmented healthcare, and our care would go back to providing meaningful, compassionate, hands-on care to our patients. Thank you so much.
Thank you very much for that meaningful and a powerful message. Thank you. And ladies and gentlemen, I'm pleased to introduce the final presenter of this session on the topic of AI for a global health pandemic preparedness engine. Here at the site, we're joined by Dr. Newton Wahome, Senior AI ML Lead of CEPI, or Coalition for Epidemic Preparedness Innovations. Let us welcome him to the podium with a big round of applause.
So thank you, everyone, and thanks for the great talks. I'm really happy to be presenting here at the World Bio Summit. And I'm from the Coalition for Epidemic Preparedness Innovations. And what we've been doing over the last few years is building an integrated AI ML platform for Disease X. So what is Disease X? We have this mathematical variable across more than 25 viral families that could infect humans. So, for example, you've got filoviruses like Ebola, Marburg, you've got paramyxoviruses like Nipah, you've got arenaviruses like Lassa, and so let's try to do this mathematical solving for X. So on the y-axis on this graph, we've got time. We need to respond as quickly as possible. So within 100 days, how can you make a medical countermeasure against an unknown virus? On the x-axis, we've got one of the medical countermeasures, such as the vaccine research and development pipeline. So you first have to think about your monitoring. Where is this sequence coming from? And then, what do I know about this sequence? Can I actually make it into a good vaccine? Can I develop it at scale in a rapid way? And then, what should I be doing in terms of my clinical trial design? How should I be thinking about the safety or unwanted adverse events? Can I take all this preclinical and clinical data and submit it to a regulator efficiently and in time, so that way I can be able to deploy a solution? So at CEPI, we've been working across this whole value chain of R&D, where we're starting from monitoring. We have a program that's focused on viral intelligence and strategic threat assessment, focusing on spillover from animals to human hosts, building models that can help us with surveillance tasks. We're also thinking about discovery tasks such as virus escape. How should we be classifying virus families, glycoproteins of interest, and have all this information in a core knowledge base? We're also thinking about vaccine design. What are the rules for making a good immunogen in terms of its biophysical characteristics? Can I express this at scale? What do I know about its antigenicity and being able to optimize it so I get a good neutralizing response? Is there a way for me to do good structural validation of this? And then in terms of our platforms, what should I choose? Should it be mRNA? Should it be adenovirus? Should it be protein? Is it rapid response? Is it stable? Can it survive the cold chain? What about its shelf life stability? How should I be thinking about the formulation in terms of if it's a protein subunit, what adjuvant should I be using? And then when I go to the clinic, is there a mathematical way to understand my clinical trial design for this population so I can be able to start really quickly? What are my correlates of protection? How am I thinking about efficacy and all the immunological properties that are necessary to make sure that my countermeasure is actually working? And then for my platform and the sequence of interest, how am I thinking about adverse events? What am I thinking about reactogenicity? Is there a way that I can correlate known platforms with what I'm working on? And can I do this in an effective way so that I can make decisions as quickly as possible? And lastly, as I mentioned, is there a way to digitize this information so that I can be able to make a regulatory submission as quickly as possible? So CEPI has been funding and working with partners that are developing data, tools, and models across this whole value chain. And the idea is, can we be able to synthesize all this information into a common platform? So I've shown you we have this DiseaseX question. We have this DiseaseX knowledge base of tools that we're putting together. So how do we query this knowledge base or database in a way that's efficient? And this is what the Pandemic Preparedness Engine is. So it's a secure, open access AI assistant so that any vaccine developer during an outbreak can be able to query and ask relevant questions across the R&D chain. And the hope is for it to be a virtual scientific collaborator to help researchers advance vaccine development tasks. And the goal is to make sure that this is a paradigm shift and an aid for the 100 Days mission. So the way it works is very similar to an AI assistant. So the scientist enters a query to the engine processes the answer is validated across this DiseaseX knowledge base, and you can ask questions across the R&D pipeline. So you might be interested in paramyxoviruses, so you can ask the engine, can you rank and prioritize these paramyxoviruses? And it'll let you know, I've seen this Nipah sequence of interest. Do you want me to help you with an R&D strategy? And you can ask questions related to formulation, surveillance, design, as well as clinical trial optimization. So the other question that we have is, like, CEPI has been funding all these data tools, and we're trying to have an efficient way to be able to access it. Where should it be located in a global and secure way? So we've started thinking about the concept of AI factories or supercomputing centers of excellence that give access to regions and nations, give them access to state-of-the-art AI models for industry, energy, critical infrastructure such as health. So we've started building this DiseaseX knowledge base and the engine with Argonne National Lab, which is around the third fastest exascale supercomputer on Earth. That's in the US. We've put together a work plan with the European Vaccine Hub to work on their first exascale supercomputer in Europe, known as Jupiter. And over the last few weeks, we've been having discussions within Korea with the KDCA, KAVAD, on how could this be implemented within Korea and on the KISTI-6, or your new petascale supercomputer that's going to be available in a few months. And the reason we're interested in the AI factory concept is to make sure that every nation or every region can be able to control their data as well as the compute on top of their data. So here I've got an example of 3 AI factories, one in the African Union, one in the European Union, one in South Korea. So you have local compute to be able to manipulate your raw data. You can generate your own regional model or local model that anonymizes and maintains data sovereignty. You can pass that anonymized model towards this global infrastructure to build a global model, and then that can be pushed back or distilled to the AI factory without exposing sensitive data from your nation or from your region. And so that's our idea about security and access by design using federated learning. On top of that, because we're working with virus sequences and manipulation of virus sequences, we're taking the biosecurity guardrails quite seriously. So the AI factories need deep cybersecurity layers. We also need a way to think about the managed access and vetting the data and making sure you can follow who is working on this pipeline. And then we're putting in scorecards to make sure that we can be able to evaluate the safety of each of the queries that are put within the engine. And then we're also thinking about the transparency and explainability of the models in terms of data sharing and accountability. Finally, we're also building an autonomous biosecurity agent to be able to automatically flag any misuse of the agents. So finally, in summary, we're focused on how can we responsibly use these data and AI tools within a global health and pandemic response context. Can we be able to provide a global health assistant in the form of the pandemic preparedness engine? How are we thinking about its security and responsible use? And can this be a distributed global resource to help CEPI achieve its 100 days mission? And with that, I'm finished, and thanks again for inviting me.
Thank you. Thank you very much for your presentation. Thank you. So ladies and gentlemen, we've listened to our 5 presenters at session 1, and we will be welcoming our moderator and our presenters once we are ready to set the stage. So for that, we'd like to take a short break for about 5 minutes. We recommend you to please remain in this hall and be seated, that we can soon begin this panel discussion. Thank you very much. Ladies and gentlemen, we'd like to welcome you back to the venue that we will resume with the panel discussion of session 1. Please enter the hall and take your seats. 네, 여러분 저희 1세션의 패널 토론 바로 시작하겠습니다. 네, 이제 장례로 여러분 입장해 주시고 착석해 주시면 고맙겠습니다. Before we begin session 1's panel discussion, we'd like to welcome our moderator and esteemed panels and of course presenters. Please come forward that we can be welcoming you momentarily up to the stage. Thank you. To our esteemed presenters and speakers, if you are in this room, we'd like to welcome you to please come up to the stage and take your seat. Thank you. And ladies and gentlemen, we will soon begin a panel discussion of our first session. So ladies and gentlemen, now please proceed to the venue and take your seats as well. Thank you. 네, 여러분 저희 잠시 후 좌장님과 연사분들 준비되시면 패널 토론 이어가겠습니다. 아직 착석하지 않으신 분들, 입장하지 않으신 분들 입장해 주시길 바라겠습니다. Ladies and gentlemen, welcome back to session 1. Now we will begin this panel discussion. We will focus on the future direction of health AI. As you can see, we're joined by our moderator and esteemed panelists on the stage. And ladies and gentlemen, allow me to introduce our moderator once again, Professor Kim Joo-han, Executive Vice President for Research of Seoul National University. He will be leading us through this meaningful panel discussion. Let us welcome our moderator with a big round of applause.
Good afternoon. We are now starting our discussion forum. Everyone is waiting for lunch, and we've already a little bit late. So we are going to reduce the time to, I'm going to try to do my best to finish it in 45 minutes. Okay, we have had 5 distinguished speakers, and we also have today 3 more panelists. As you have listened, I think this session has been organized in this way. So starting with the regulation and governance issue by the director from WHO, and then we moved to some technological issues. So we have a session for strategic support for medical AI from Japan, Dr. Hisanaga, and then the Dr. Cha presented their approach from digital transformation to AI transformation, and then we moved to the next topics of clinician acceptance from the hospital system, and then global acceptance for pandemic preparedness. I think that's my understanding of this talk. So, and I have received from the organizer 3 questions about today's topic. And we have 3 more panelists, Dr. Eungyam Ki Yuan from Singapore, National University Health System, and Dr. Na Gun Ho from Naver Health, and actually he moved to, okay, Dr. Ye Jong-chul from, Professor Ye Jong-chul from KAIST School, a Graduate School of AI, Kim Jae-chul Graduate School of AI, KAIST. So we have 8 panelists today. Then we have 3 questions. One is, the first one is the domain area issue. So what are the best field or domain that is expected to be most thirsty or most demanding and most effective and most impactful, especially with respect to global collaborations, because the session is for World Bio Summit 2025. The second question is about the governance and regulation. What type of and what shall we do for this rapidly developing health AI? And the third question I got was the literacy, accessibility and acceptance kind of issue of newly emerging technology to our traditional healthcare and public health system. But I received these 3 questions, but I'd like to start from the last one, because Dr. Basilia has to leave a little bit earlier because of his tight flight schedule. And so the third question is for having better health AI to make it successful and sustainable. What are the issues with respect to our health AI literacy, acceptability, accessibility, and acceptability? Even though we don't have enough, good enough literacy in health itself, but we have a challenge for that. So why don't we start from new panelists? We don't have any sequence, but Dr. Professor Ye, could you start from this question?
Okay. So, yeah, I'm Jong-chul Ye. I'm a professor at Graduate School of AI. So, as you can notice, I'm more like a technology-driven guy who believed in technology. I used to be a people who think the technology is the most important part. But I was working on healthcare AI for many, many years, and also working as a president of Korean Society of Artificial Intelligence in Medicine. What I realized is the most important factors for successful integration and sustainable utilization it's not the technology, but one of the most important factors I realize is that for the success of AI is easy accessibilities and user-friendly interfaces. For example, Dr. Ballis, during his talk, he mentions about one-page AI summary, which actually integrates everything in one summary without even noticing what's going inside. In fact, think about the smartphone, for example. Even though most of the people don't know what's going on inside, and most of the people don't know the wireless communication protocols, still everyone enjoy it and use it because it's so convenient and intuitive. I think healthcare AI should be like that. It should follow the same principle. They should be designed and implemented so seamlessly that people can use them even without noticing that the underlying mechanism is based on the AI technologies. So I think that's actually one of the most important factors for the integration into the healthcare system.
Dr. Balisia, would you like to comment on this?
Yes, I cannot agree more. I think that, as always, the answer is it depends. It depends of what type of question is brought to you. If you are willing to take some kind of a simple bottom line or a more detailed, explainable approach. When it is something that is very technical, repeatable, something that you know how it is done, you are willing to take the answer of the computer as is. We all send our blood tests to the lab, and we know somehow the erythrocytes get counted, not by people, but by machines. We don't ask what has happened there, how did it happen. We just take the result as is, face value, because we understand the process and we trust it. But when it comes, I think the same would go for some clinical procedures that are very, very technical. These will be automated, the bottom line will come in, and actually at some point, the physician will get out of the loop. A lot of this will get automated with direct communication between the patient directly with an AI decision support. But when it comes to more clinically complex, meaningful decision-making process, patients come to the physician to get advice, to get support, to get something that is more meaningful than just a very basic set of diagnostics. And I think for that, the physician cannot depend on the bottom line alone. It needs to somehow comprehend what are the key factors brought into the decision support recommendation, and it needs to weigh in because that's what the patient expects them to do. That's why they came to them. So if we want, for that purpose, for the AI to be meaningful and accepted, in order to gain trust of both the physician and the patient, you will have to go one step further and provide some kind of guidance as to how the decision was made, what is the pathophysiological, what is the biological mechanism, what is the sense, the clinical sense in the recommendation for them to trust it and then convey this trust to the patient to follow that advice.
Is there any comment on it? Well, actually, even the healthcare system is not, do we really have healthcare literacy and accessibility now? Or, and even with that unprepared situation, we have to accept this kind of high-tech artificial intelligence. Would it be doable and possible? Could you comment on that? I mean, who would you like? Yeah? So you have, struggled from digital to AI transformation. Dr. Cha, could you?
Yes. So you can see this is like a least rehearsed. This is very live. This is very honest discussion. So I just want to add additional aspects on this literacy. So there are two things I want to discuss over this issue. One is I believe, I want to recall our memories during the COVID-19. So every people, even though they are 9 years old or they're 20 years old, had to go through these checkups through their mobile. So I believe if it matters, and if we persuade our patients or providers that it matters that what they react to their app or their AIs or their phone, then they will, sometimes fast, sometimes slowly, they will adapt to it. So during my talk, I said that we send out our patients 10,000 surveys every week, and the compliance is over 85%. Most of them are over 65 years old, and they need to do it. They want to do it, and they learn because they know that it matters. That if they don't put it in, they will be put in the back into their line when they visit their outpatient clinic. So they know and they experience that it matters. It's a feedback. It could be feedback by person. It could be feedback by app. Then they get the motivation and learn. I believe that's the one side of the literacy that we want to think. And the other part is from healthcare perspective, we need to be more focused on how we design the feedback or the transparency of the AIs or digital tools. So we had this discussion 5 times in our hospital to put one small red dot for patients, which indicate the physician need to react on some kind of information. Then we had to go through all the discussions because we know we need to be very, very careful putting one small information on top of the EMR or on the app. And that's the other aspect. As a designer, as an operator of the system, have to be careful on those feedback that will affect on patients and providers' literacy on their reaction. Thank you.
Yeah, doctors and patients are struggling for better health care. And what about our educational system? Is our healthcare professional and technological education good enough, well prepared for the next?
Can I respond to that aspect? So my observation is that I agree with the comments from the older panelists. I would add one element: reluctance to adopt AI-enabled healthcare tools among healthcare professionals. I see this is one of the obstacles that we have to overcome. Questions from them is, will I be replaced by AI? Will healthcare workforce be replaced by AI? I believe some of the healthcare workforce have worry on this. And for me, a right answer would be AI will complement but not replace human capability. If we go one step further, you might be replaced by AI if you don't know how to use AI well. And if you know how to use AI well, AI will help you and to provide high quality services. But to make this happen, my suggestion is, it is government's health ministry, education ministry to develop digitally transformed health workforce for the future. That is a task in front of us.
Any other comment, Tony? Yeah.
So I'd just like to add to this discussion around education, because we are in a world where AI is pervasive, right? We are going to have AI not just in healthcare, but in every aspect of our lives. So I think we can start with that and start moving education more and more towards what we understand as mainstream education today. So I speak on behalf of, say, Singapore's education system, where we are starting to teach AI at a very fundamental level. So in the National University of Singapore Medical School, we are teaching AI as part of a minor in a biomedical informatics, right? And we want our medical students to be able not just to use the AI, but to design AI so that when they become doctors, they don't just become users, they are the ones who originate and come up with the new AI tools. And this is vitally important because rather than trying to get people on board by teaching them small courses, I think you make it pervasive, you make it part of the workflow, you make it part of everyday life. I think that's one way where we can get people to adopt AI better. And lastly, I just want to say that, for these conferences, these panels, they are very important to bring up the awareness of how important AI is, and learning from different health systems that we saw this morning on how AI is being used really inspires everyone to think about how they can use that in their day-to-day lives. Yeah.
So I would say for education, it'll be really good to instill critical thinking and a way to be able to understand what the output is. Like, what actual confidence do I have in the output from these models? How transparent and explainable is it? So I think we had a trial run around 20, 25 years ago when the internet came. So when you did an initial internet search, there are different kinds of websites, different kinds of answers that come out. Eventually people started to understand, okay, this works, this doesn't work. So how do you instill the principles for being able to evaluate these models within the education system in the early phase as well as in the medical space?
Two comments. One on the training and the availability of these tools. The young physicians, they're there. They are not waiting for any one of us. Even if the organization or the hospital says, I cannot put JetGPT into my system because there's too much cyber issues and too many privacy issues, they have it on their handheld and they use it again and again, even if you don't know it. So to some extent, we need to kind of face reality and understand that if we do not create better tools that are available on the organization level, they will hack it and they will find other ways to use it. So I think this will go anyway from bottom up, and as we develop better tools that will become available and take their place, then we will be able to somehow have better control on the process. Regarding if AI will replace or augment, I think that if we would like to believe that it will not replace physicians, nurses, and at least some of our, that's a good thing to believe, but I think that is not probably going to be the case. I think that like in every other profession, some of the people will be replaced by AI systems, and you know what, that's okay. And a lot of parts of our jobs today as clinicians, it's being clerks. It's typing in things, it's doing very technical approval processes. As we say in my country, I'm doing a job that a trained monkey could do. So if as an MD, after 15 years of studies, this is the level of procedures I need to do, maybe it's better that the AI will do it and I will do other things. And so I think AI will distill our profession to the things that we went to med school for the human connection, for the support, for the complex assessments, and a lot of the technical stuff will go away. It will go away, and AI will replace a lot of the frontline work that we're doing today.
Yeah, we have many. Could you?
Yeah, so to add to that point, I firmly believe that these newer AI tools, and you speak about some of them, especially agentic tools, will start replacing many of the baseline clerical tasks. But on top of that, it will be able to solve some, I would say, second-order kind of reasoning tasks. So things like, how can you come up with a better treatment suggestions, right, given a set of complex diseases? And that is just for the clinical aspect of things. You can imagine there are multiple administrative aspects of things. So for example, in my hospital, what we do is that we use an AI agent to help us optimize the distribution of manpower, nursing as well as doctor manpower, at different times of the month, because we can predict the number of patients who are going to come to the emergency department, and therefore we can come up with an optimized scheduling roster for that. So these are the kinds of tools that would replace many of the administrative work that was previously done by a few people or a group of people, taking up many, many hours. So I think that job losses are inevitable, but it's not necessarily a bad thing, because it just means that people will start working on other kinds of skills, higher order skills, as Professor Bollister pointed out earlier.
So we have many challenges, threats, concerns, as well as hopes for better healthcare empowered by our health AI. given that, why don't you move to a little bit more specific question of what are the specific fields or areas that can be helped by health AI? What are the most demanding part, and what are the most expected to be most effectively changed? What about Dr. Na? Could you, yeah, from Neighbor, what are you doing in Neighbor Health?
Thank you very much. So as a IT search engine company, for example, we evolved during last 5 years during the pandemic epidemic. First, we helped in conjunction with the Korean government to establish the tracing technologies, the QR code tracing for the COVID. And number two, we moved on to make automatic telephone calls to those who encountered a COVID patient with telephones. And number three, we moved on and make AI calls, we call it Care Call, to call senior citizens. And number four, we moved on again. Now the AI, the telephones are addressing the senior citizens and loneliness, dementia, so more of important issues that we face today. As we look at the healthcare AI as a company point of view, I think the number one utilization may be how to ease the heavy workload of the physicians, and the other side is the long waiting list for the patients and the healthcare, the consumers. So I think the many examples are here today. The issue, I think, is we have too much AI literacy, I say, because as mentioned, is like the internet, the government, the hospitals, the physicians cannot control the utilization of AI. For example, in all of our clinics, our patients walks in with the answers from the AI engine, and we have to address these answers generated by AI. It's like many years ago, the people were asking Google or Naver about their health conditions, but it's more to a challenge now that we just cannot ignore those information generated by AI. I'm sure there will be regulations instituted by government and the authorities in near future, but in the meanwhile, for a few years, I think we healthcare providers, the institutions have to figure out what is the optimal level of coexistence in this abundance era of AI literacy. Thank you.
And are they profitable? Okay, so anyone else? Yeah, we have already experienced this kind of issue from the introduction of internet and the mobile systems, and then now we have AI. Yeah, so from the company perspective,
Yes.
would it be profitable for the?
I think for the profitability of these technology, I think we have to address in three parts. Does it bring in more income, or does it save your cost? I think already the AlphaFold has exhibited it has saved cost in doing the drug discovery research. We have many examples on saving labor cost, both in administration. Naver runs a appointment system for many industries, including healthcare. So those industries have consistently shown that it will save costs and make it profitable for the companies who provide these solutions. The key question is, can you make money on these advices? But I think that's why recently the Microsoft, Mr. Bill Gates has introduced the Microsoft Orchestrator, where it's a free advice. So large companies will offer these advices for free, but in the meanwhile, we have to validate these answers. Otherwise, I think some of the incorrect information could be abundant in our healthcare space.
Yeah, beyond that, yeah. And we actually have two speeches on public health and global health perspective for this field. So did you have any comment on this for not for the clinical practice, but for public health and global collaboration for this kind of matter?
Can I?
Yeah.
So, as I mentioned in my presentations, WHO recommends the countries to identify and prioritize high-impact use case of AI. We hear clearly potential high-impact use case of AI in AI-assist drug discovery, and then AI-assist clinical decision-making, and then some very clear question about can AI help efficiency of the hospital? My topic of presentation, I intentionally tweaked my topic to future health equity. Here, I want to counter-argue as one potential high-impact case, which is not loudly heard in this conference room. So WHO recommend if you want to achieve health for all, you should strengthen primary healthcare system. Question, can AI help primary healthcare system? WHO answer is yes. And then AI has more potential impact, high potential impact in primary healthcare if we use it AI for this, even though it is not big market enough. Let me share a few examples which WHO is supporting, and then considering to supporting. So one example is AI-assisted community tuberculosis screening program. Tuberculosis is a major public health issue in remote and underserved area where access to healthcare personnel or diagnostics labs are quite limited. We introduced AI-empowered mobile digital X-ray. With this, and as primary health care workers can take X-ray, and then AI-assisted device can provide that finding immediately. No need to wait. Before chest X-ray film should be sent to central hospitals, waiting for the time of the radiologist, and it took a couple of weeks or a couple of days. The AI-assisted TB screening program will strengthen primary health care. Another example that we are considering to support is AI-assisted diabetic retinopathy screening. Diabetes is a major NCD in Asia and the Pacific. Diabetic retinopathy affects approximately 1/3 of the diabetes patient. So diabetes patients need to be screened, retinal screening. In remote resources country, we have limited eye doctors. We have limited trained nurses. So very long queue. So if we introduce AI-assisted retina screening tools, that will help access to diabetic retinopathy screening and then prevent permanent visual loss. That is some areas we WHO believe high impact use cases that should be also considered as a potential areas.
Yeah.
So I would say at CEPI, we're thinking of this in an end-to-end way for vaccines R&D, as well as a way to promote equity across the globe. So what we've seen over the last few years is that we have sort of new AI deserts occurring where a lot of the leading models are being built in specific countries and others don't have access to them. In parallel, in terms of vaccines R&D, we have similar issues in terms of equitable access to manufacturing technologies, design technologies, ways to coordinate surveillance. So at CEPI, we're thinking, how do we bring these two issues to bear in a global way. First, global access to AI models, and then access to state-of-the-art tools for vaccine R&D, and that's what we were presenting. We think AI will be a great engine to be able to support our core mission, as well as be a way to globally coordinate across different partners.
Having been leading a WHO collaborating center for non-communicable disease prevention and control over the last 11 years, I have to fully agree with the opinions that have been made. I think primary care is the most important basis of a sustainable healthcare system, especially these days when non-communicable diseases take an unproportional size of the expenses and the impact in every society. High-level primary care is really hard to attain. It is probably the most, I'm not intending to insult any surgeon or any internalist in the room, but being a good primary care physician is one of the most difficult tasks in healthcare. And being able to advance high-level primary care in every country, regardless of its affluence, is very difficult. I think AI in primary care could be the great democratizer, the great equalizer that will allow high-level primary care to reach the points of the earth where you cannot find a good primary care physician and you do not need to move into breakage care and to hospital care when everything else falters. So I think this is truly going to be transformative in healthcare globally, move the needle towards more preventive, proactive approaches from the breakage points that we see right now, and make healthcare more sustainable and more impactful at the very end. And again, my apologies for having to leave early to catch a flight. Thank you.
Okay, let me add some of my insight on this topic. For example, I think we need to, in terms of adopting AI, especially in the market, we need to consider 3 stakeholders. 3 stakeholders: doctors and patients, and also, of course, companies. So I think depending on the country, the situation, whether this is underdeveloped countries or depending on developed countries, that the portion of importance or maybe the abundances and those things are a little bit different. So the consideration may be different, but even when there are enough doctors, I believe still there is a AI product is useful, especially when all those kinds of benefit for 3 stakeholders are satisfied. For example, like instead of replacing doctors, if AI can provide additional information that doctors can use, and also that information is very critical for the patient survival or like the prognosis, I think the patients will adopt those kinds, want to use that technology, and that can make money for the companies as well. So I think we need to actually think about all 3 stakeholders depending on the countries and the situation, and see which we need to focus on more, and which kinds of AI technology we need to be adapted in specific region depending on the 3 shares of the 3 stakeholders. Yeah.
Yeah, very, very diverse demands, need and expectations, approaches and hopes. So AI must be, very busy to do solve all those things. Yeah. Is there any, given that, so different countries, different situation, different healthcare system requires different requires different solutions. So is there any, may I have one very top question? So is there any one big thing, one ring that rule them all kind of solution do you have? Or will we have that kind of thing in the near future? Or will it be very much diversified? What's your expectation?
Perhaps can take that question. Of course, we would love to have a whole ecosystem type of AI where it's applicable throughout from the EHR system all the way to your handheld mobile phones, whether it's an app or a chatbot. That's of course desirable because it solves many of the interface issues as well as the data issues on the back end. However, we know that this is never going to be the case because there are so many diverse systems and applications today. And one of the opportunities I think that we can have is to set up some form of interoperability and standards so that different systems can interact with each other. And on the other point about AI adoption, similar to this point, is that if you want to get down to the primary care, get down to the patient, we have to have a very good interface to talk to patients. So using interfaces like Naver, for example, right, is one way to reach out to the masses. But if you combine that with a accurate and reliable, and earlier we heard about trustworthiness kind of AI behind it, I think that will be transformational.
Okay. Because everyone is waiting for their lunch, and lunch will solve the big problem. And why don't we move to the last question of regulation and governance? Do we even need that, or what kind of, personally, family-wise, nationwide, and globally, we need some kind of governance and some strong collaboration we need. So what are do we need, and what kind of regulation and governance do we really need in the near term? Can you?
May I? So I want to tweak this question a bit. At the end of the day, what kind of governance mechanism do we want to see? I would say the system like this: collect data once, use many times. All the governance system, all the regulation system should solve for this kind of the situation. This has been the discussion of the many global conferences, including UN General Assembly last year. The leaders gathered for Summit for the Future. They adopted digital compact. And the WHO is recommending to make this happen, recommending governments to invest on digital public goods. Digital public goods, the bottom line is a fundamental digital public goods such as digital ID, financial transaction, consent-based data sharing. On top of this, WHO recommend health ministries to invest on digital public infrastructure for health. This includes common registry system, such as a common terminology, patient registry, facility registry, health workforce registry, product catalog. In many cases, interoperability is hampered by different systems, different countries use different registry, different digital ID. So it will take time, however, to achieve the status. Collect data once, use many times. Companies need to develop tools. However, our recommendation to the government, please invest government budget to fund foundational digital public health good, and then also digital public health infrastructure for health, for researchers, companies to develop wonderful tools, and that tool can be interoperable.
And actually, what are the perspectives from the different parts, like industries, technology developing institutions, and clinical field? So what are the optimal kind of regulation or governance do we need? I mean, their expectation must be very different. So who would like to start first? Yeah, clinical perspective.
I don't love regulations. Nobody does. However, it is like a guideline in the sky. You get a new airplane, new rockets. You want to fly to everywhere, but if you do that, you will collide with other airplanes soon. And so there's actually, there's a way on the sky that airplanes should fly. That's for your safety, and for us, of course, for the efficiency, effectiveness of the airline industry. That exists there for a reason. So we need that. And the problem that we are facing is every day, even literally every day, we wake up and we see new technology, new airplanes, new rockets coming in, and the regulations always, by its nature, is following behind. And as a clinical part, we see one tool in the left hand that has huge potential for my work, for my patients. But if you see on the right, that has also risks. The more we depend on the technologies, of course, the risk grows. That's the nature of that. So we have to find a balance. That's the obvious word. And to do that, I believe that we need kind of not the regulations, but before the consensus and the collective intelligence that we have to define certain area that we can safely test, and we have grow the new AIs. And the other area, we should be very careful using it. And at my viewpoint, we don't have the consensus yet on even this rough classification. So I suggest starting with that discussion, and that will have us our new guidelines, which is very practical.
So I would say at CEP we've run into this very issue where there is no consensus, and we're trying to work across different countries. So many countries want to limit regulation or regulatory oversight so that they can win this gold rush towards AI dominance. And so they want to limit governance and regulatory oversight as much as possible. So at CEPI, our idea is let's partner with responsible actors and try to come to a best principles consensus and have self-regulation and try to utilize principles that then can be turned into a future governance framework. But I think in the interim, there's this rush towards the Wild West. Everyone is building train tracks, and we're asking, should we regulate transportation, right? So it's a complex time to think about oversight, but hopefully the responsible actors can come together to build a consensus and a foundation for the future.
Just a quick comment on that. I think we must not make the mistakes that was made, in the late 1990s and early 2000s when internet became popular. It was the same it's a bit of the same situation now in AI. At that point of time, there was no regulation against hackers, for example. So had they been able to regulate or stop people from developing malicious code, we wouldn't have this issue today of viruses, malware, and etc. So similarly in AI, we are at the beginning of, I would say, a revolution that will change the way we work and live. We should put in good regulatory frameworks and structures to ensure that the AI is not misused, and at the same time enabling it to leverage the capabilities of the AI.
And any final comment on it? Okay. Does industry has any opinion about regulation? Is regulation bad or an optimal regulation even good for your approach? Okay, yeah, because industry members are a little bit sensitive about their position because, yeah, as you all may know. And I do appreciate, when I start this session, I expected to solve many problems, but I think I got more problems after the session. So why don't we make our health AI busy and busier? Please give all the big hand for all those panelists, please. And then I do thank you for all your attention. Let me close this session. Thank you.
Thank you very much. Thank you to our moderator for leading the session, and thank you to our esteemed panelists for sharing their valuable wisdom and knowledge. Ladies and gentlemen, this brings us to the end of session 1. Thank you very much for your participation. We do have a session 2 at the Dynasty 3, and please come back to this hall for session 3. And please note that during the closing session at the end of the day, we will share key outcomes of session 1 as well. So we ask for your active participation and ongoing interest until the very end. Thank you very much, and please enjoy session 2 as well. Thank you.